Pulmonary critical care, I think, is like the perfect balance of everything. It gives you the opportunity to see patients in their sickest, most acute state in the ICU. You have the opportunity to be able to take care of patients longitudinally in clinic, and you have the opportunity to do procedures, that can be exciting and fulfilling. The goal of our program is really to develop a well-rounded physician. Every individual trainee needs to go through the basics and then gets the opportunity to develop their own personal interests, get to choose what they want to do. And our graduates have ended up doing about 50% academics, 50% community practice. Our fellows get a really large breadth of procedures. They're going to get all of the standard procedures in the ICU, things like central lines and thoracentesis and chest tubes, but they're also doing very advanced procedures, including in the ICU, including Swan-Ganz catheter placements and pericardiocenteses. Interventional procedures throughout their pulmonary training, including pleurex catheter placements, tracheostomies, endobronchial ultrasound, robotic navigation, and we have 2 world-class interventional pulmonologists who help facilitate all of their training. So it's always surprising to people the extent of diversity of pathology here. We see complicated infectious diseases, we see complicated structural lung diseases, we see very complex autoimmune conditions, we see very complex critical care patients. Fellows have just a ton of direct mentorship. Every rotation, they're essentially paired up with an attending dedicated to the patient care and the teaching experience, and really ensuring that whatever direction the fellow wants to go, that they have guidance and mentorship and advice. And then we also have the ability to pair the fellows with connections outside of our institution if they have special areas of interest. Just the community is pretty amazing. You get to have a lot of interaction from very specialized physicians as well as primary care physicians. You get to know all of the staff really well, and that can include the nurses and the respiratory therapists. We have wellness events throughout the year to kind of encourage the family model that we have here. We are a very supportive program, and we're very receptive to making changes. Every year we evolve into an even stronger program. So it's a nice place to have your own training, but also to be able to craft the future.